Please stand by. We're about to begin. Good day and welcome to the Bipartisan Policy Center, My Healthy Weight, a solution for employees to address obesity. Today's webinar is being recorded. At this time, I'd like to turn the conference over to Ms. Hannah Martin. Please go ahead.
Thank you. Good morning, everyone, and thank you for joining us for our webinar. My name is Hannah Martin. I'm a Senior Policy Analyst with the Bipartisan Policy Center's Prevention Initiative. For those of you who are not familiar with BPC, we are a nonprofit bipartisan think tank based in Washington, D.C. Our topic areas include health, energy, immigration, education, the economy, and more. Joining me on the webinar today are Jenny Bogard and Tracy Zvinyich. Jenny leads My Healthy Weight for BPC and has worked with us for many years. First as the Director of Healthcare Strategies at the Alliance for a Healthier Generation, and now as a co-founder and managing partner of Commonality. And I'll let Jenny introduce Tracy a bit later on. At the end of today's presentation, we'll have ample time for Q&A. We'll be using the chat box feature on your screen to collect questions. So if at any time during the presentation you think of a question, please go ahead and submit it using the chat box rather than waiting till the end. And just a reminder, you will not be able to ask questions using your microphone, so please use the chat box for all your questions. And with that, I'd like to pass it off to Jenny to walk us through the My Healthy Weight initiative.
Hi, Hannah, can you hear me?
Yes, you are live, Jenny.
Okay, great. Good morning or good afternoon, everyone, depending on where you are. I'm so thrilled to be able to talk to everyone today about My Healthy Weight, which is a solution for employers to address obesity within their employee population. So for those who are wondering, well, what is My Healthy Weight? Well, it's the first ever collective initiative among multiple different stakeholders that provide obesity prevention and treatment for individuals of all ages. We launched My Healthy Weight in 2017, and I'm going to go over the timeline in a couple of minutes, but wanted to just share the founding members of the My Healthy Weight initiative. And as you will see on this slide, there are different stakeholders from Medicaid state plans to large employers to insurance companies. And throughout this collective initiative, over 10.5 million people have access to the services that are provided through the My Healthy Weight program. So I want to just step back a little bit and talk about why My Healthy Weight is needed. And I know everybody on this webinar today probably hears about this on an ongoing basis. And we know that the latest research shows that upwards of $1.4 trillion, with a T, dollars are spent towards treating obesity-related diseases and complications here in this country alone. But what's more important is we know physical activity and chronic diseases are a direct result, physical inactivity are direct consequences and results of obesity, but I really want to focus on the top 5 bullet points here. And I've been working in obesity prevention and treatment for over 15 years. And when I first started down this path, I was working with medical associations and several insurance companies across the country. And through my research and outreach, working with these different organizations, what became very apparent to me is the lack of consistent coverage for obesity treatment and prevention. And what that means, to simplify it, is when you have a physician seeing 30 patients in one day, that physician is dealing with 30 different benefit design plans. So that physician doesn't know if that patient has access to additional services, if they can refer them out, if they can schedule a follow-up call. So we know from the literature out there that the default behavior is that the physician won't do anything. So essentially, you have a gap in coverage and care. So that patient comes in either for a physical exam or for an acute issue, and sometimes that physician doesn't see that patient again for a year to 3 years. So there's a lot of missed opportunity there for that patient and that physician to have an ongoing dialogue around obesity prevention as well as early treatment. We also know there's a lack of effective communication based on the lack of consistent coverage. So we know that employers struggle with this. We know that insurance companies struggle with this, that they don't know how to effectively communicate this when there isn't a blanket coverage of obesity prevention services. So an example is if you only are offering a preventive program to a very small set of employees, you don't know how to effectively communicate that. It's better to broadly message that out to all of your employees so that everybody has the same set of services and the same set of benefits offered to them. And we also know that this trickles down to the claims. So if you don't have a blanket coverage of a preventive program, we do see some claims being denied in the system. And then finally, just lack of awareness. How do we engage healthcare providers that extend beyond physicians to nurse assistants, to nurse practitioners, to wellness fairs, to health coaches, et cetera? All of these touch points are so critical to continue to support employees as well as their families as they try to navigate through their journey in health into achieving optimal health for themselves and their families. So who qualifies as My Healthy Weight? What does this mean? So I'll go over the timeline in the next couple of slides, but really what we decided to do collectively as a group, and collectively meaning that our task force members that were comprised of, again, Medicaid state plans, employer groups, and insurance companies, decided that we need to first align our coverage and reimbursement offerings to the USPSTF recommendations. And for those who may be unaware of what those are, these are recommendations that were set from an expert advisory board based on the literature and science and evidence-based out there. And we know that we can see change in BMI and chronic disease if individuals who qualify have access to a set of services. So on this slide, you will see that individuals with a BMI over 30 have access of up to 12 visits. And this goes down to pediatrics. So pediatric patients in the 85th to 95th percentile get access to up to 8 visits with a healthcare provider. And this doesn't have to be a physician. It could be a registered dietitian or a health coach that has the expertise to continue to support that patient throughout their journey. So some additional pledge components. We heard loud and clear, the project support team did, that the task force members really wanted to have a community-based component in the pledge. And this was because a lot of the task force members recognized that only so much can happen in that exact exam visit, that a lot can also happen and occur in that patient's community. They're going to the YMCAs, they're going to local-based organizations, they might be going to a group-based therapy session to discuss their weight issues. The payers, the task force members really wanted to acknowledge that this microcosm, if you will, this environment has to be, in order for it to be successful, we have to have multiple different touch points for a patient and that individual to be able to continue to have care, again, as they go through this journey to achieving optimal weight management. So we have a community-based component included in the pledge. We also have a commitment to engage their members. So you can't just offer something and not talk about it and engage your employees around it. So how do you create these materials and these opportunities to have conversations with your employees? And then we have some optional pledge components as well for some employers who may be further along in terms of how to engage their employees. And we are here as a product support team to be able to support them as they think about those. So how did we get to where we are? Well, as I mentioned, we launched a task force in October of 2016, where we brought together multiple different payers from all across the board. And we asked them a simple question: what are you doing in your organization to treat and address the obesity prevalence? And what can you do? And what are the challenges? And we really went in with no real agenda, to tell them what to do. We wanted to hear, and it basically was a listening tour for 2 full days, listening to the payers, understanding the challenges, understanding where they are, and where we can help them as a project support team. From those 2-day meetings, we had 20 pages of notes that we synthesized. And then over the course of an entire year, we had extensive follow-up with each of those task force members, whether individually, in virtual meetings, in-person meetings, and we really wanted to continue to reflect back to the task force members what we were hearing as we created this initiative. And through those multiple meetings and conversations, this pledge was birthed, if you will, and created. And it really was a group effort, and all the components of the pledge were from conversations and those meetings that we had in the prior year. And we officially launched it in November of last year. We had an in-person meeting in Washington, D.C. at the BPC office where we invited some of our founding members to talk about why they were committed to this. Why was it important for them to be part of this national movement? And the hope and the goal is by January 1 of next year, everybody will be compliant to the required components of the pledge. So why join this initiative? If you're an employer and you're thinking, why would I want to sign on to this? Well, really it can help you with your short-term and long-term goals. It can also actually elevate your company's commitment as a project support team, and through the support from the Robert Wood Johnson Foundation, we've actually created materials for our My Healthy Weight members using a marketing communication expert to develop materials that they can use to engage their healthcare providers, to engage their employees, and to talk about it within their community as an early adopter to really addressing obesity prevention in a very comprehensive way. We also, this gives you an opportunity to raise awareness and reputation as, again, a leader in your community. We know that every employer out there faces issues with rising healthcare costs. And we know that obesity prevalence continues to increase in the majority of the country. How can we collectively work together, break down those silos, and create something that really will be meaningful and impactful? And we as the project support team, we know this pledge is just the foundation. It's just the beginning for our members to start those internal conversations within their HR departments, within other departments, within their organizations, but as well as with their employees, is really supporting their employee and his or her family beyond the time that they're in the office. Really creating this additional ongoing support to create a healthier environment for everyone. And through the last course of the year, and this is just a quote from one of our founding members from Medicaid in South Carolina of really the value. And as we continue to talk to our My Healthy Weight members and work with them over the last year since they've signed the pledge, really what we've heard loud and clear from them is that, look, we joined this movement not even knowing what was out there in terms of resources. And this opened up so many doors for us as an organization. We're invited to meetings that we didn't even know existed to talk about benefit design plans and evidence-based programs. We're getting additional resources that we can utilize and we can send to our employees that we didn't even know were out there. So it's not an additional to-do item on someone's task list by signing this pledge. Instead, it really is opening up a door of opportunities and a world really of opportunities and resources at your fingertips that you can use, because we really are stronger together than we are separated when we're addressing obesity in this country. But I'm going to end with just saying that it's one thing for me to sit here and talk about how wonderful this initiative is, but I really want this to be an opportunity for everybody on this webinar to hear from one of our actual members of why they decided to make this commitment. And if anybody is interested in learning more about this program, I'm available offline. I'm also going to be at Obesity Week next week in Nashville talking about this at a reception next Tuesday. So if anybody's going to be there, please reach out to me. I'd love to invite you to that reception to learn more and meet me in person. And finally, I'll end before I pass it over to Tracy, is that we are currently also publishing a perspectives paper with the National Academies of Medicine. So we're hoping that that will be published in the next 2 months, and we'll be able to share that with everybody who attended this webinar. But thank you again for joining. I hope I was able to give you a glimpse of the context of this program, the value of joining as an employer. And with that, I will pass it over to Tracy.
Thank you, Jenny. Hello, everyone. My name is Tracy Zvenich. I'm an Associate Director for Obesity Public Policy at Novo Nordisk, and I appreciate the opportunity to share Novo Nordisk's employer experience with the My Healthy Weight initiative. So today, I'd like to quickly just address a few items, a little bit about Novo Nordisk, our commitment to chronic weight management, our employer perspective, about the My Healthy Weight initiative, as well as examples of our approach, roadmap, and lessons learned, and then a few summary key takeaway points. So at Novo Nordisk, we are a global healthcare company with more than 90 years of innovation and leadership in diabetes care. This heritage has given us experience and capabilities that also enable us to help people defeat other serious chronic diseases, including obesity. We at Novo Nordisk recognize that it's important to improve care for people living with obesity in the U.S., and positive change needs to happen on multiple societal levels, including policies and with employers. We also recognize that obesity is a serious, chronic, progressive disease, and people with obesity deserve care. And our ambition is to lead in driving change in this disease area with an unfailing belief that it can be done. So behind this ambition, we have a strong focus on addressing the significant unmet medical needs in obesity care and tackling the many barriers to effective care that people with obesity experience. So we continue in our long-term commitment to improve the lives of people with obesity by partnering with the community on education and advocacy, increasing access to care, and advancing medical management. We at Novo Nordisk aim to be a driving force in the science of obesity, deliver obesity solutions that matter, ensure obesity is widely recognized as a chronic disease, and reduce barriers to prevention and treatment. So at Novo Nordisk, we have a commitment to chronic weight management, and our goal is to break through the barriers preventing effective obesity care in the U.S. We have prioritized our investments to tackle 3 core issues. The first is mindset. The science is telling us more and more about this serious progressive chronic disease, where we need to move the mindset of the broader community from an acute weight loss to a chronic weight management mindset. Secondly, funding for care. We are looking to educate and influence to expand funding for access to obesity care and coverage for the full spectrum of treatment options. And then last here, critical mass, where we're looking to increase the number of healthcare professionals and patients who understand and receive training to engage in meaningful chronic weight management. So at Novo Nordisk, we were pleased to sign the My Healthy Weight Pledge, joining healthcare leaders from across the nation, including private and public payers and employers, to offer obesity prevention and treatment for individuals of all ages. My Healthy Weight was very much in line with Novo Nordisk's long-term commitment to improving the lives of people with excess weight or obesity. And we know that obesity is not a lifestyle choice or simply about willpower. Like any other serious chronic disease, treatment typically requires an individualized, comprehensive, and long-term treatment plan, including lifestyle interventions and medical management. So we offer a comprehensive approach to obesity treatment for our employees, enabling them to take advantage of options to reduce stress, obtain counseling, prescriptions for chronic weight management, or surgical interventions as needed. We at Novo Nordisk met the criteria for the My Healthy Weight Pledge after a pretty quick and simple review of the benefits and programs that we currently offered. A few examples include nutrition counseling for all ages under our medical benefit, a discount to a weight management program, health coaching services, as well as fitness and health products. And as Jenny mentioned, at Novo Nordisk, we recognize that simply offering coverage does not mean that care will be received, and we commit to working with providers and beneficiaries to increase utilization of these benefits and to encourage the collection of obesity metrics. We agree that the My Healthy Weight initiative can reduce short and long-term healthcare costs and productivity loss. It can support company health commitments and goals, and increase the reputation as an employee-centered and health-conscious company. And then lastly, access support for company commitments and goals. Next, I'd like to just share briefly our approach for the My Healthy Weight initiative in Novo Nordisk, and that includes elements of a kind of a practical roadmap and lessons learned that include leadership champions, internal communication, field team engagement, and external communication. So the first step was to align the My Healthy Weight pledge with company mission, with our company mission and business goals. So that really allowed us to identify some champions among our leadership. And then once identified, we engaged those key members of our executive management for support. Next, and very importantly, we collaborated very closely with colleagues in our human resources and communications teams. Once leadership was aligned and supportive, we focused on how to communicate about My Healthy Weight, communication internally, communication out to our field-based teams, and then communication externally. For internal communication, we included information about My Healthy Weight in the 2019 Open Enrollment Benefits brochure that went out to all of our employees. We also plan to share a detailed article upcoming in the new year on our Ask Human Resources portal, as well as also share a quarterly update email from members of our key leadership within the company. For field team engagement, we have plans to alert our field teams, so we have joined this pledge and what that means. We are looking to create a leave behind resource for use with other employers, highlighting My Healthy Weight and Novo Nordisk's commitment to obesity. And last, we have plans to update one of our websites called novonordiskworks.com with relevant information on My Healthy Weight. And last, for external communication, My Healthy Weight plans to be included in our corporate social media platforms. We're also looking to include My Healthy Weight in next iterations of various materials and resources. And finally, update My Healthy Weight on our corporate website. So next, here I've just summarized the elements of our approach to implement My Healthy Weight at Novo Nordisk in this simple table under the different pillars. And then in summary, in closing, here are just a few of the key takeaways we have learned as an employer participating in My Healthy Weight. The first lesson learned was to align the My Healthy Weight pledge to the organization's mission or goals, and then engage key leadership for support. The next key takeaway was to collaborate closely across human resources and communications teams. And then we've also been working very closely with BPC and the project support team for resources and support. And I think the last two bullets are really the points I'd like you to think about and take home with you today. And it simply is that participating in My Healthy Weight was a lot easier than it may seem up front. Any employee can be a champion for My Healthy Weight within their organization. And then from an employer perspective, My Healthy Weight is really a turnkey benefit for employers to show their commitment to improving the health and lives of their employees. So thank you for your time and the opportunity to overview Novo Nordisk's experience with the My Healthy Weight initiative. My name and contact information is shown here for anyone that would like to reach out. So thank you.
Thank you so much, Tracy. We have a question actually for you. Can you explain the Leave Behind resources that were created for employees at Novo Nordisk? And so I think this question is about the ones that you've made, but perhaps, Tracy, after you weigh in, Jenny, maybe you can speak a little to the materials that the marketing firm also made, just so we can make sure that we're covering whichever they meant to ask.
Sure. Thanks, Hannah. So at Novo Nordisk, we in our annual benefits mailer, there's a whole page, an overview, and additional information for how Novo Nordisk supports the My Healthy Weight Pledge and the elements of our services and benefits that meet the initiative. So that's one resource. We also have resources on My Healthy Weight and those benefits and services on our human resources portal. And then working closely with Jenny on project support resources as well to come.
Yep, great. Thanks, Tracy. And then I'll just add 2 additional things as I mentioned earlier, and Hannah just mentioned. We do have materials that a marketing firm has created, and that is mostly content that can be put into any existing materials that an organization has. So rather than creating a brochure, if you will, we've created the information to put into a brochure because we know that organizations communicate with their employees differently. And the most important part from our perspective is to create that actual content and information. So we will be sharing that with our members in the next couple of days. We just got all that back from the firm earlier this week. And then I should also mention one additional resource for members is that throughout the pledge, you'll notice that this is all around evidence-based programs. And we heard loud and clear from our task force members is that they don't necessarily hear the latest and greatest in terms of evidence-based programs that are out there, and that sometimes it can take years, quite honestly, until that trickles down to an employer or to an insurance company. So we have created, in response to that, a password-protected repository site where we are collecting evidence-based programs from across the country that meet all the different components within the pledge. So some are community-based, some are focusing on pediatric patients, some focus on the family, some focus on the adult individual, and we will have all that information up on a website so when members sign the pledge, they will have access to that website that they can go in and peruse at their own convenience. If they're looking for a particular program, they can, check off the boxes, and then those programs that meet that criteria will populate, and they'll be able to read more about it and also have the contact information if they would like to reach out to that researcher or that organization that created the program. So that's another additional resource for our members that they will have whenever they would like to use that.
Great, thank you. Just a reminder, if anyone has a question, to type it into the chat box, and we will stick it in our queue. Jenny, this is actually a question from me, since we're talking about all of the resources that signatories get after they sign on. And Novo Nordisk had probably one of the easier sign-on processes because of how much their company was already doing in this area. Could you speak to some examples of support that you gave to current signatories who maybe had a little more challenging time pushing things through with leadership at their company, and some of the things you were able to help them with?
Absolutely, and that is correct. Novo was one of the easier ones to get this signed and approved internally. So we know that organizations have multiple different individuals that have to approve of a program, and that some of the information can get lost when you're having some of those internal conversations and meetings. So in the past, what we've done is when possible, I've actually gone into organizations and sat with multiple different people from different departments and have walked them through the program. I've had webinars specific to organizations, so they have a team of people that they need to brief on and get their internal approval. We've set up webinars. I've had individual calls with individuals who may not have been the lead at a particular organization, but knew that this person had to have a buy-in in order for it to be pushed through. So really, we are here for you in terms of what is the best fit to get internal approval. We have lots of information. We've also actually had a lot of our peer organizations. So some of our My Healthy Weight members have talked to other organizations who are interested in offering or joining this program. And an example of that is we've had several Blue plans from across the country that are looking into offering this, but felt comfortable talking to another Blue plan that is offering it. So we're here for you in any way that fits best for your organization and how that information is disseminated.
Great. Tracy, a question for you. Can you give an example of a company mission element or business goal that was aligned with My Healthy Weight?
Sure. So at Novo Nordisk, we simply have a commitment to chronic weight management, and one of our goals is to break through barriers preventing effective obesity care in the U.S. So the My Healthy Weight Pledge, with its core, one of its core elements around addressing inconsistent coverage and breaking down other barriers to prevention and treatment, we're just fully aligned to my company's mission and goals around breaking down those barriers and our long-term commitment to chronic weight management.
And I have a two-part question now. Jenny, these will probably be for you. One is how do registered dietitians become involved in a program like this? And then similarly, how can practitioners of all stripes help convince businesses and insurance in their area to start taking the pledge so that they can get involved?
Yeah, so that's a great question. And for some who may be on the call, we talked a little bit about this at the Academy of Nutrition Dietetics annual conference a couple weeks ago. So I think really is, as an individual registered dietitian, if you have your own practice, is really having those conversations with the insurance companies that you work with. So if you have any contact information at those insurance companies, reach out to them, let them know about My Healthy Weight, let them know about that it is a national initiative, that there are multiple different insurance companies that are participating. If you're an RD that works within a healthcare system, going to your employer and saying, we should be offering this as an employer, we should be walking the talk, and this is information that that you need to be able to make that decision. Connecting your employer to myself or my team is also an opportunity or an option for you. We are happy to have those conversations if you just want to do the handoff, but really trying to become that change agent within your community and within your own network. So even if you may not have a lot of connections at an insurance company, any physicians that you work with, they work with insurance companies. So really trying to use the angle of getting this information out as much as possible, letting physicians know, letting healthcare providers know, letting your employer know if you're part of a larger healthcare system, and then also any insurance companies or even employer groups that you work with in your community. It's really just spreading the message and is really going to get more traction for this program, and it's going to help to continue to grow it. And, I talk a lot about our big audacious goal, and, my big audacious goal for this program really is that we reach a tipping point in this country that more people than not have consistent services offered to them for obesity prevention and early treatment. And that is a long-term goal, and we have a long ways to go, but we have to continue moving forward and pushing the boundaries and reaching out to employers and reaching out to insurance companies and engaging multiple different organizations and stakeholders to achieve that goal. So this is a this is a group effort. It's not just going to be myself going around the country and talking about it. It really is going to be this collective movement. And we're seeing that with our current members now, and hearing Tracy talk about it and some of our other members is that there is so much value to joining this movement from a member perspective. And I'm sorry, Hannah, did I answer the second question? I don't know if I did. I can't remember the second question.
I think you got to it a little bit. I just wanted to echo what you were saying about this being a group effort. Tomorrow's webinar, we're going to be doing another one of these that's focusing on Medicaid and hearing from South Carolina. And they have fantastic coalition work going on across the entire state with heavy input from the South Carolina Academy of Nutrition and Dietetics. And that's a bright spot and a best practice, but that type of coalition work can happen anywhere, and it just takes the first 1 or 2 or 3 people who are really enthusiastic about something to grow that kind of movement. So we're hoping to find more groups like that to work through to increase sign-on to My Healthy Weight. So a question for you, Tracy. You mentioned that Novo Nordisk already offered some of the benefits of My Healthy Weight, or maybe something similar, before you signed on. Do you know anything about how those are being utilized, and do you have any plans about tracking that or tracking outcomes or anything starting in January?
Yes, Hannah, thank you so much for that question. So in collaboration with my colleagues in human resources, I believe there are, full plans and intentions of tracking utilization and insights on the services and benefits that we're offering in alignment with My Healthy Weight. The plan year starting January 2019. So more to come once we start officially tracking that and doing that self-assessment.
Great. So we have answered all the questions that have come in thus far. I want to give it another 30 seconds to a minute. We have plenty of time if you have questions. Just get those in. But otherwise, if I don't hear anything in the next minute or so, then we will let you all go. Jenny or Tracy, anything you want to just add in closing in case we don't get any last questions?
Yeah, I think I'll just say that, again, I encourage everybody to think broadly. So if you're an employee of an organization, if you're a healthcare provider working with organizations, if you're an individual that really wants to be that change agent within your community, to think about how you can kind of pull this all together and really drive it within where you are. And I'm here for you. And if you have questions or need to pull me in, I'm happy to have those conversations with any particular organization or individual. But again, we really just want to cast a wide net as possible so that everybody has access to these services. And I'm here to help make that happen, so you know how to find me. So please, please, please reach out to me if you have any questions.
Great, and I think I would just add that, this is a really easy, simple, turnkey benefit that employers can offer their employees to demonstrate their commitment to health and wellness within their business. So thank you to Jenny and Hannah for all the support with My Healthy Weight.
Thank you to you too, Tracy. Well, we haven't got any additional questions, so thanks to you all who submitted them. If you come up with anything after the webinar, feel free to email us. A recording of today's presentation will be posted to the BBC website early next week and sent to everyone who participated and registered, so you'll be able to see the slides with the audio laid over it when we send that around. You can always visit myhealthyweight.org for more information or contact Jenny. And with that, I hope you all have a fantastic and healthy afternoon.
Thank you, everyone. Bye-bye.